Hey everybody, so we're here with our patient Greg. We're going to be doing some StemWave. He's been receiving several treatments so far. This is actually our last one. It's treatment number 8. We've been working on his left knee. So I'm going to kind of walk you through what we're doing here for it with the StemWave machine, why we're doing it. First and foremost, our patient is a delivery driver for several decades, so he's experienced a lot of knee pain walking up and down hills all day, in the truck, out of the truck, picking up packages. So this has been tremendously beneficial for him so far. So why don't you come over here and I'll show you what we're doing. We use ultrasound gel as the medium. So here's our applicator head. I'll first kind of want to just spread this around the whole area that we've been treating. It's always very important for our patients to, vocalize to us as we're treating. I can get some really good feedback through the applicator head when the shockwave enters the body. It will ricochet back into my hand as long as I'm contacting the applicator head here. I can get a much better sense too from the sound it makes, whether the shockwave is hitting scar tissue versus inflammation. But there's nothing better than patient feedback, so we always ask that they do that for us as well. So I'm following the same protocol I have been for Greg because it's been working so well. Where he's going to get treated with 700 shocks. He's going to get 2 every second, and then our energy level is 0.12. So right now I'll be just kind of covering the general area. I have my landmarks. When you know your anatomy, you'll know where you should be. Muscle insertion points or into the middle of the joint line where, our ACL, PCL is. That's going to be like right in here. I'm in that medial joint line. And if I get a little bit of feedback, which I kind of do right in here. Yep, you feel that? Yep. I'll hang out here for 10 seconds or so. I'll cover structures like the MCL. This spot here is called the pes anserine. This is where one of our hamstring muscles, along with a couple of our adductor muscles, attach right into here. It varies individual to individual, based on where the damage is. So right in here, he's telling me he feels right here, that's in the lateral joint line. So I'm kind of shooting right into the center of his knee. And now I want to hit the quadriceps tendon. So as our quad muscles come down, before they stretch over the kneecap and form the patellar ligament. And Greg, while I'm doing this, can you tell us a little bit about your experience?
It's been fantastic. Went from constant pain going up and down the stairs to barely any at all to within the past couple of weeks, no pain at all.
That's great.
All worth every treatment.
Yeah. Yeah, we've seen a lot of good progress, especially for you in your line of work over the holiday season.
It definitely helps in the cold weather, because that was usually when it affected me the most.
Yeah.
Now it's no problems at all.
That's great.
Very happy.
Wonderful. So we're going to finish up here. Thanks so much for joining us, and we'll see you next time.